My name is Dr. Mandy Yap Yee Yee. I'm a consultant hematologist who has been practicing hematology for about 18 years. So my specialty is actually in hemostasis and thrombosis. And now you can see I'm actually advocating patient blood management, and we had successfully conducted a 3 days patient blood management conference with the theme Recipe for Optimal Blood Health, as you can see, for past 3 days from 13 to 15 of February. And we are so lucky to get all these speakers and chairpersons from all over the world. As you can see, we have Professor Dr. Arashanda, Professor Dr. Shannon Farmer, and then we have Sherry Ozawa, we have Dr. Karen Trentino, and then we have even collaboration with Asia Pacific Society of Patient Blood Management from Korea. And they have brought in so many other international delegates and speakers as well, like today. And we have such a great fun. Patient blood management is very important in the sense that we have done this for past since 2012. And we realized that if you actually utilize the 3 pillars, the first pillar, which is optimizing red cell mass, second pillar is minimizing blood loss, third pillar is harnessing tolerance to anemia. It has actually helped to improve all the patients going for operation. Those days, patients just go for operation, they were requesting blood transfusion. And the outcome was being done through research studies. They have shown that versus those who don't receive blood transfusion, for example, utilizing patient blood management, they had better outcome in terms of operative outcomes. With the sense that how we important by optimizing the blood health, hence today's the theme of the patient blood management conference. You can see today we are talking about blood health because we want to move away from transfusion completely, so that we can tell you, all of you can just optimize your own blood, and before you go for any procedure and surgeries, you can just maximize within your own self by using intravenous IV iron, as well as using erythropoietin stimulating agents. What is the best method? So first of all, when patients presented to us, we have to do a screening, like full blood count and iron studies, to look for any iron deficiency anemia or any other causes of anemia. Everybody must know that the causes of anemia can be so diverse, including B12 folate deficiency, as well as other related disease. For example, nowadays we have functional iron deficiency, like anemia of chronic disease, anemia of inflammation, anemia of chronic infections, that due to all this heart failure, kidney failure, or even underlying hypertension and diabetes. You can, which is, the approach is slightly different from absolute iron deficiency, which is due to iron deficiency anemia alone. So the approach, in the sense that, like just now I have mentioned, we use the IV iron, or sometimes we can use oral iron. But bear in mind that oral iron you cannot really absorb very well sometimes, and a lot of patients suffer from side effects. For example, like GI upsets, the intolerance, they vomit, or some of them get diarrhea as well. So they have no choice, have to resort to parenteral iron, in a sense, to top up their absolute iron deficiency. And subsequently, with the anemia of chronic disease, just now I mentioned, related to all those chronic inflammation, chronic infections, and underlying heart failure, kidney failure, as well as diabetes, hypertensions. Those you have to even use erythropoietin stimulating agent in order to synergistically, together with IV iron, to correct this population's kind of anemia before they go for any surgery or operation or procedure. Come to my conference. I probably will do it again next year, with my team over there. So yes, for those who doesn't understand patient blood management, I welcome all of them. Please come and interact with lots of all these experts and key opinion leaders from all over the world. We are very happy to welcome you. We are just one big family. Don't be afraid to learn about patient blood management. It's a very good practice. It will certainly will improve patient outcome. Thank you very much. please call me. I'll come and help you to conduct workshops and even collaborate to do talks, or we have some practical workshops, like hands-on. We can put up like scenarios, to educate all the healthcare professionals how to approach all the cases if you want to. Thank you very much.